and thank you for inviting us to tape our program here today. Beth, can you start out by giving us an overview of the facility?
Yes, thank you, Councilmember Alvarez, for coming today and giving us an opportunity to talk about our hospital in the community. HealthSouth is the largest provider of rehabilitation services in the United States. We're a large corporation. We have a little over 100 hospitals. We're in 27 states, and we even have 2 hospitals in Puerto Rico. We're licensed as an acute rehabilitation hospital, and so we serve patients here that have been at another acute hospital that have either had a stroke or been in an accident, suffered a brain injury, maybe a hip fracture, and they're referred to our hospital here. And our focus here is on rehabilitation. So they'll undergo physical, occupational, and speech therapy, and it's an intensive setting. They do about 3 hours a day. And our whole goal here is to get everybody to go back home, back to their prior level of care. So we get about 78% of our patients back home.
In my introduction, I said your goal is to get patients back on their feet. What's your average stay?
Our average length of stay here is about 14 days. Some of our patients that might be an ortho case might stay 7 to 10 days. We might get a stroke or a severe brain injury that might stay here 21, 28 days, but right in the middle is about a 2-week length of stay.
What can patients expect during their stay? What is the routine?
Well, each patient has a very individualized plan of care, but there is some routine for the patient. They get up in the morning, get dressed, have their breakfast in our dining room, and then they really start their day. They'll have 3 hours of therapy during the day. There's a schedule posted in their room every night so they can anticipate what their day will be like. They can look at when they're going to have their therapy schedule, and some of them may decide, like if they have physical therapy at 8:30, they might have another session at 10, and so there'll be a little break in there that they can kind of gain their strength and rest and get ready for the next session.
And Dr. Kravetz, who are your patients and why is it beneficial for them to come to HealthSouth?
Well, first of all, Councilwoman Alvarez, I really want to thank you for coming here. We're just glad that you're doing well and that you're recovering from your injury, and it's just it's great that you guys want to get some information out into the community about our hospital. Most people are not really aware of what we do in our hospital. I think the exposure to inpatient rehabilitation is pretty minimal, and probably a lot of people are aware of it nowadays because of what happened to Congresswoman Gabriela Gifford. She was obviously shot and had a devastating brain injury, and after she was stable enough, she was sent to Texas and was admitted to an inpatient rehab hospital. And our facility here at HealthSouth is the same type of hospital. We do the exact same things that Congresswoman Gifford went through. The types of patients we take are usually medically complex patients that have been admitted to the hospital. They may have had a stroke or a spinal cord injury. They may have had some orthopedic injuries, fractures. They may have some other medical problems. So we get a fair number of patients that have had Parkinson's disease and multiple sclerosis. And I think the biggest thing that differentiates us from other facilities is that we have the intensity of therapy and the medical management. A lot of patients will get sent to a skilled nursing facility or a nursing home, and that's really all they're familiar with. Many doctors and even other people in the community just don't know what we do. So we try to get them into our hospital and get them back to being as functional as possible. And we also actually admit patients from home and from doctors' offices. So we are just kind of a comprehensive inpatient rehab facility.